What's up, guys? So, I guess more nursing school updates. I just got off another 12, so I'm still full time, and this is definitely the hardest thing I've ever done. This is ridiculous. I'm exhausted, super tired. So I don't know what I'm doing. I'm crazy. So I'm gonna bang this. We're week 7 now. Week 7, boom, down, that easy. So it's going fast. It's going quick. Almost done. This is a 10-week class, and then we got 6 weeks of mental health, and then it's summer. So I'm just gonna keep going. I got this. Not much to update. I'm doing okay, guys. I guess the only update is that I need to improve on my NANDA and attaching my assessments and correlating my assessments and my interventions directly to my NANDA that I'm using. So there may be other problems that the patient's having, but I need to focus my assessments and focus my interventions that I'm writing down on the NANDA that I have chosen for the patient as the highest priority. So that's something so I'm working on that. That's, I guess, my thing to work on this week. That's my project. Other than that, we got a proctored ATI exam coming up, but it's only extra credit. If we get a level 2 on the proctored ATI, we get 1% extra on total grade, and then if we get a level 3, we get 2% extra credit. So I have some practice tests I'm going to take and see how that goes. So I'll find that in a few weeks, I guess. But I think one thing that was really interesting to me, and I thought I'd talk about, maybe someone can chime in and let me know what they think, is clinical reasoning and clinical judgment, and how critical thinking correlates with that, and being able to verbalize your thought process out loud, and how that helps with critical thinking. So, for instance, let's just talk about what needs to be done to take out a chest tube. What do we have to do in order to be safe taking out a chest tube? Thinking about it just critically, I don't have any notes. I don't have any, I haven't studied this stuff. I'm just going to pull from my head. So let's see. If I'm going to take out a chest tube on a patient and I'm thinking about it, one, I want to listen to lung sounds. Okay, are their lung sounds good? Fully throughout. How's their SpO2? Are they having dyspnea on exertion? So a full assessment before we pull that. How much fluid is being pulled? Have we clamped it for 24 hours? So those are all big things. If all those things are cool, great. When we take out the tube, we're going to use an occlusive dressing, and then seal it tight so that there's no air leakage. Also, as we pull it out, we have them hold their breath so that we're not, having chest rise and fall as we pull it out. We don't want any air to get in there. So those are a few just critical thinking things that I would want to do to be safe about this. The last thing would be get another x-ray after we've taken out the chest tube, reassess lung sounds, reassess SpO2, reassess pain, so are the lungs functioning properly, and is there a change in status post extubation of the chest tube? So being able to, I guess for me personally, this is just my experience, being able to verbalize that out loud, being able to walk myself through the steps, not having anything in front of me, and just thinking, okay, what are my priorities? Why is this important? How can I be safe about it? And then talking it out loud. For me, it's been helping. So maybe I missed something. Maybe, I'm trying to think through it. Did I miss anything? And I don't think so. I think that would be the safest way to do it. I mean, as long as it's been clamped for 24 hours, there was a chest tube before, there was an x-ray before, x-ray after, occlusive dressing, SpO2, chest, lung sounds. I mean, that sounds good. I mean, as long as it's safe, as long as we're not seeing a decompensation, as long as, we're not pulling out with, an active, pneumothorax or hemothorax, there's no bleeding, no atelectasis, looks good, he's good chest rise and fall, good lung sounds, we can pull that thing, occlusive dressing. Hey, okay, so I just talked through that whole thing again for no reason. That's just how it goes. So I'm tired, and this is how my brain works when I'm tired, I guess. So, being able to verbalize your thought process can really, for me at least, help with my communication skills and with critically thinking through things we're doing. And I watched like an hour lecture on YouTube of an Australian nurse who was doing a presentation on clinical judgment and clinical reasoning. And she said some pretty crazy thing. They did a study in, I think it was England maybe, but basically nurses, registered nurses with 10 years of experience minimum, considered a professional, at 10 years of experience, I think 10 to 15% are not safely critically thinking for their patient. They are critically thinking at an unsatisfactory level to maintain patient safety. So what does that mean? That means just because a nurse has like 10 years of experience doesn't necessarily mean that they're thinking critically through their care. So a lot of them are great. I'd say 90%, comes out. Only 10%, 10 to 15% aren't critically thinking at that level. But that means that, there are just some people who aren't getting it. A small amount of people aren't fully, haven't, at a professional level, a safe level, able to evaluate on a high clinical level. So I don't want to be that person. Do not want to be that guy. I want to be able to evaluate as a whole, hone in on the important stuff, don't forget the little stuff, and really be able to verbalize my thought process. And that's another thing she said, if you're able to verbalize your critical thinking skill or your thought process while you're doing something, that helps. So you need to practice. That's not something that comes easy. You really need to practice these kinds of things. And so talking about them, really, talking about clinical experience, talking about your assessment, what you witnessed or what you see, and what you think something might be happening. For me, it's helping a lot, I think, because I'm able to do this in the clinical setting. In my clinicals, I'm able to do this. So that's kind of cool. I guess that's my main thought, and the chest tube thing, that's just a small little example, because this gets, this blows up to a major scale when we talk critical care and we talk, emergency interventions and stuff like that. So, and maybe we can talk about that later, but I guess that's going to be my video for now. I'll make other videos later about other stuff, because I want to talk about all kinds of stuff. So maybe I'll start making more than one video per week, because since as of now I've been solid like every Saturday for the past few weeks. I've been making a video, but maybe I'll bang one out halfway through the week on other random crap that I like, because I like money and I like making money. So, and I like talking about making money. So that's just a hobby of mine. So I just like it. So maybe and saving money. That's, because it's fun if you make it, but then if it goes bye-bye out of your account, hey, what's the point? Who cares? Didn't get anywhere. You're still at zero. So the goal is to make a little money and then put it away so it's not leaving that account. So those are, I guess that's it, guys. I'm tired. I got a care plan to write tomorrow. So hit a like if you got this far. Hey, hit a like, hit a subscribe, give me a comment, talk to me. So have a good one, everybody. Good week. God bless.